The following short video will review exercise before and after total hip replacement or total knee replacement. There are a few key objectives that will be reviewed in this video. Exercises that you can do to prepare for your surgery, planning your rehabilitation after discharge from the hospital, what to expect from exercise or activity after your surgery, some key factors to aid in your rehabilitation after surgery as well as your goals, and overdoing it, which everyone does at some point during their rehab. So some key factors with exercise before your surgery. There's some good evidence that exercise before your surgery can help improve your outcomes after surgery. Specifically, exercises that are designed to help improve the flexibility and strength of your leg before your surgery are the key ones we ask you to focus on. You want to perform the exercises only to your tolerance. If you find any of the exercises you're trying to do significantly increase your pain or swelling, you need to stop those exercises, or I recommend calling one of us in physical therapy and following up with us with any questions about this. Now, one of the hardest things when you have a painful joint to do is to determine how much pain you should have when you exercise. Many people have heard the saying, no pain, no gain. This is not the optimal way to exercise before your surgery, as you're likely to increase your pain or swelling, which may then discourage you from performing the exercises that can be helpful. Therefore, a better saying is safe but sore. Having some degree of soreness during exercise is normal, but it should be lasting for a limited time and should be manageable. Another good way to think about this would be if you do your exercises, you're a little sore later, but by the next day you're back to your baseline pain level, that you're better off to keep doing the exercises. If you have so much pain that you're unable to exercise the next day, then you're going too hard on the exercises, or one of the exercises may be a problem for you. If you're able to determine which exercise is causing the increase in pain, you can go ahead and discontinue that exercise and continue with the ones that you're managing well with. During your recovery, there are a few different types of therapy you may go through. They include inpatient, which is in the hospital. Their main goal is to get you ready to go home safely. Some patients after total hip or total knee replacement do need VNA services or home therapy. Their main goal is to help teach you how to manage things at home. Many patients after total hip or total knee are able to go directly to outpatient therapy to help you get back to life. Now, there are some differences depending on which type of joint replacement you're going to be having for your exercise program after surgery. For a total knee replacement, you want to set up your appointments as soon as possible. Don't miss your appointments and make sure you continue with your PT until you reach your goals. Due to the nature of a total knee, more therapy is typically required to reach an optimal outcome. Typically, after total hip replacement, you will not need any outpatient physical therapy. You'll do your physical therapy in the hospital, and you'll begin a walking program, which is really the main focus of your rehabilitation after your total hip replacement. We also ask patients after their total hip replacement to avoid any extreme positions. Now, when you look at your key focuses after surgery, in order to rehab like a pro, you really want to focus on three main goals. So, number one, pain control and swelling management. Icing regularly, elevation, wearing your TED stockings as recommended by your surgeon, and getting up regularly to move throughout the day to help keep things moving, which will actually typically help with your pain. R stands for reducing risk of blood clots or falls. So those are two things we really don't want to have happen after your surgery. There are many different ways you can work on decreasing the risk of these, including sticking to the medication recommended by your surgeon and taking it on schedule, making sure you're pumping your ankles or moving your legs throughout the day regularly to keep the blood moving, getting up and walking regularly. And to reduce the risk of falls, you want to make sure that you always use the call bell in the hospital, and that once you're home, you want to use an assistive device that further reduces your risk of falls. And always be cautious when you first get up from sitting to make sure you're not lightheaded or dizzy before you walk away. The last main goal is O for optimizing range of motion or optimizing walking. So if you're having a total knee, your main goal is to optimize the range of motion of that knee, its ability to bend and to straighten. If you're having a total hip, your main goal is to optimize your walking distance gradually by sprinkling in small walks throughout the day and gradually increasing as your soreness allows. Often patients are motivated to discharge their assistive device or get rid of their assistive device as soon as they can after their surgery. In therapy, we typically discourage this, as often the assistive device is a significant benefit in the early rehabilitation. Not only does it reduce your risk of falling, but it also keeps you from limping. And if you practice limping, you'll get really good at limping, and it'll be a hard habit for you to break later. The other thing that can happen if you stop using the device too soon is you may have increased pain, increased swelling, or a decrease in your range of motion, which, if you remember my last slide, was really the most important 3 goals. So using the assistive device for a week or 2 longer will help improve your outcome in the long term. To review your main goals of your rehabilitation after surgery: ice and elevate the leg 5 to 6 times a day for 20 to 30 minutes at a time, with an hour or so between sessions. If you're using the cryo cuff for your total knee, you can often ice consistently by just recooling the water as it warms. You may want to consider gently massaging the thigh muscle on the front of your leg, just making sure you stay above or below the bandage or the incision. We also want to remind you not to put any lotions or oils near the incisions or bandage. But gently massaging the muscle in your thigh often can help with soreness and improve that muscle's ability to function. And again, let soreness be your guide. Make sure you're getting up and walking a little bit every hour. Performing small walks every hour helps reduce your risk of blood clots, as well as gets you moving, which then often helps with reduction of your pain as well. Gently tightening and releasing your leg muscles or pumping your ankles throughout the day will help to keep blood moving, reduce your swelling, and reduce your risk of blood clots. Remember, performing small, short sessions of your exercises during the day, rather than performing them all at once, often is tolerated better. If you do them all at once, often you get sore, and then you don't want to do anything for a while. So focus on frequency with your exercise. Sprinkle them in throughout the day, one here, one there, making sure you're doing something active and moving every hour. There are a few other key reminders after recovering from your surgery. Number 1, you always want to remember your key goals, and above all, listen to your body. Recovery is about balancing how much exercise, activity, with how much rest you get to get the optimal response. Often patients are very motivated early on, and they push too hard in the first 2 weeks and aggravate their symptoms. The first time you try something new, go a little bit easy, see how it goes. If it goes well, next time you can go a little harder or do a little bit more. As time passes from your surgery, you should be able to do a little bit more and more of each activity with less soreness or less symptoms afterwards. Now, we talked about this at the beginning. Everyone at some point overdoes it during their recovery. It's the nature of recovery, as recovery is not linear. And don't freak out over a flare-up, as they're normal. Everyone does it. A few things to keep in mind with flare-ups. You can't harm your prosthesis, but you can slow your recovery down for a day or so. That's the most common thing we see, but most patients are afraid they may have done something wrong to their joint replacement. In general, mostly you overdid it, and it will calm down in a day or 2. If you have any significant concerns, feel free to reach out to your doctor's office or your physical therapist. Once you have a flare-up, the recommended action is to listen to your body, slow down, keep moving, but go a little bit easier with your exercises for a day or so until the soreness calms down and you're able to increase again. Remember, be patient. You will do really well after this joint replacement, but it often takes quite some time to get to your desired outcome. In addition to this video, there are other resources that you might find valuable to watch, including how to walk with a cane or walker, how to go up and down stairs with a cane, how to get in and out of a chair, and exercises that you can work on before and after your surgery. The specific exercises outlined in the following videos are the ones you will be performing after surgery. These are also good exercises to help prepare for surgery by improving strength and flexibility. And as an added benefit, you will be all ready to go after surgery, as you'll already be familiar with the exercises. If you have any questions before or after your surgery regarding any of your exercise program, please feel free to reach out to us at Concord Rehabilitation Services at Concord Hospital Center for Sports Medicine and Orthopedics.